If you eat bananas and have high blood pressure, there are 8 mistakes you should never make, especially after 60. At first glance, they seem harmless, but some of these are incredibly dangerous. I spent hours digging into the research so you get the answers in minutes. Let's start the countdown at number 8, and trust me, this is one mistake you don't want to make. Mistake number 8 is one that affects millions of people right now. You might be doing this today. Most people with high blood pressure take a medication from one of two families, ACE inhibitors or ARBs. Names like lisinopril, enalapril, losartan, or valsartan. Here's something most people never hear from their doctor. These drugs raise your potassium level. That's part of how they work. They block a hormone that normally flushes potassium out through your kidneys. But now add a banana. One medium banana has around 422 milligrams of potassium. That's not a small amount. So if your medication is already pushing your potassium up, the banana pushes it further. This is called hyperkalemia, which is high potassium. And high potassium does not help your heart, it can disrupt it. Medical researchers have published case reports about exactly this. Patients on ACE inhibitors developed dangerous potassium spikes after eating more high potassium foods. The fix is simple. Tell your doctor you eat bananas regularly and ask them to check your potassium with a basic blood test. One test, that's all it takes. But stay with me. What comes next affects far more seniors than most people realize. Mistake number 7 is a hidden one. Many people over 60 have reduced kidney function and do not know it. Surveys of older American adults show kidney decline is common and often undetected in this age group. Here's why that matters for bananas. Your kidneys control potassium in your blood. When kidney function drops, potassium clears from your body more slowly. The banana you eat today may linger in your system longer than you think. Day after day, it builds up. When you add that to the blood pressure medications we just covered, the risk compounds fast. Your medication holds potassium in, so your kidneys are slower to remove it, and then your banana adds more. 3 forces working against you at once. The solution is easy. Just ask your doctor for an eGFR test. That stands for estimated glomerular filtration rate. It tells you how well your kidneys are filtering your blood. It's a routine blood test. Many seniors have not had one in years, so do not wait. And now for mistake 6. This one is a daily habit, one you almost certainly have. Mistake number 6 is eating too many bananas in a single day. 1 banana is fine for most healthy adults. 2 may be okay, but 3 or more? That's where the risk climbs fast. 1 medium banana has 422 milligrams of potassium. Eat 3 and you're already past 1,200 milligrams. Now add other high potassium foods: spinach, tomatoes, orange juice. Potassium stacks up quickly. The daily target for most adults is between 2,600 and 3,400 milligrams. But for seniors on certain blood pressure drugs, even that can be too much. Kidneys in older adults work more slowly. The margin for error shrinks after 60. 1 to 2 bananas a day is a safe target for most people. More than that without checking with your doctor is a gamble. But here's what most people never think about. It's not just how many you eat, it's what you combine them with. And mistake 5 involves a specific drug that makes this combination genuinely dangerous. Mistake number 5 is about a specific type of water pill. These are called potassium-sparing diuretics. Drugs like spironolactone, eplerenone, amiloride, and triamterene. These are prescribed for resistant high blood pressure and heart failure. Most diuretics flush potassium out of your body. These do the opposite. They keep potassium in, and that's by design. But if you take one of these drugs and eat bananas regularly, you're loading potassium in from both sides. The drug holds it in, and then the banana adds more. This is a recognized drug-food interaction, flagged specifically in older patients. The fix is easy. Find out exactly what type of water pill you're on. If you're not sure, call your pharmacist. They can tell you in under 2 minutes. But the next mistake surprises people. It involves something they do on purpose, thinking it's the healthy choice. Mistake number 4 catches a lot of well-meaning people. You know that potassium helps lower blood pressure, so you eat bananas and take a potassium supplement too. More potassium, more benefit. Right? That thinking is wrong, and it can be dangerous. A supplement on top of a banana, on top of a drug that also raises potassium, is a triple threat. Too much potassium disrupts the electrical signals that keep your heart beating steadily. Medical guidelines warn against potassium supplements without direct doctor supervision, especially for older adults. If you take a potassium supplement, tell your doctor you eat bananas too. They may say the food alone is already enough, no pill needed. But here's something you probably did not expect. Not all bananas carry the same risk. Mistake 3 is about the banana most people prefer, and it may be the worst choice for seniors with high blood pressure. Mistake number 3 is about ripeness. Most people love ripe bananas. Soft, yellow, sweet, spotted. But here's what happens inside that banana as it ripens. The starch breaks down into simple sugar. The glycemic index measures how fast a food raises your blood sugar. A green banana scores around 30 on that scale. A fully ripe spotted banana can score over 60. That's double. And blood sugar spikes matter for blood pressure. When blood sugar rises sharply, your body's stress response system fires. Blood vessels tighten, heart rate climbs, blood pressure goes up. Research has linked frequent post-meal blood sugar spikes to higher sustained blood pressure in older adults with hypertension. Many seniors already have some insulin resistance. Ripe bananas can make that worse. The fix is simple. Choose bananas that are just yellow with no brown spots yet. Eat them with protein or fat to slow the sugar release down. Easy changes with real results. But the next mistake is one almost nobody talks about, and the timing involved may catch you off guard. Mistake number 2 is about timing, specifically when you eat your banana relative to your medication. Some blood pressure drugs have a peak absorption window. That's when the drug is most active in your body. Eating a high potassium food right during that window can amplify the potassium effect. There's also a natural rhythm to consider. Blood pressure rises sharply in the morning for older adults. Researchers call this the morning surge. If your medication is timed to fight that rise, eating a ripe banana right before your dose can work against it. That's the worst possible timing. The fix is straightforward. Take your medication at the same time every day. Wait at least an hour before or after your dose to eat your banana. And ask your doctor if meal timing matters for your specific drugs. 3 steps, that's it. But now we arrive at the most dangerous mistake of all. This is the one that turns everything else on this list into a real emergency. Mistake number 1 is ignoring your body's warning signs. Every mistake on this list can lead to one outcome if the problems stack up long enough: high potassium or hyperkalemia. And here's what makes it so dangerous. The early symptoms feel just like getting older. Muscle weakness, unusual fatigue, tingling in your hands or feet. The sense that your heart skipped a beat. Most seniors dismiss these. They blame age. They wait. That's the most dangerous thing you can do. When potassium climbs too high, it disturbs your heart's electrical system. That can cause irregular heartbeat. In serious cases, it can stop the heart. Published medical case reports have documented patients, none doing anything extreme, who developed dangerous potassium buildup silently over weeks. They missed every warning sign. So here's the most important step in this entire video. If you're over 60, take any blood pressure medication and eat bananas regularly, talk to your doctor. Ask for a potassium blood test. Know your number. And if you ever feel sudden muscle weakness or any change in your heart rhythm, do not wait. Get checked today. So there you have it. 8 mistakes that look harmless but carry real risk. From the drugs in your medicine cabinet to your kidney health to the ripeness of the banana you grabbed this morning. None of this should scare you away from bananas. Potassium does help blood pressure. That's solid science. Bananas are genuinely good food for most people. The goal here is precision, not fear. The right amount, the right timing, the right awareness of your medications and your health. That's what turns a good habit into a great one. And that's what keeps a small risk from becoming a serious one. You now know something many people your age do not. Use it. Talk to your doctor. Ask for your labs. And if this video helped you today, please subscribe. Every week we bring you real health research in plain language, so you get the facts that matter most. Hit that subscribe button and you'll never miss it.